Welcome, everyone, to the Orchestrating Healthcare podcast. We have an awesome episode today with Dr. Gaj Srikanthan, Medical Director at Lumeon. We are so excited to talk to him about how customers are using Lumeon within their houses and to talk with him about his background. So thank you so much for being here, Dr. Gaj.
Very nice to be on here, Ryan. Nice to take part.
Yes. And I want to talk a little bit about your background first, because you graduated from UCL Medical School in 2003 to become a medical doctor. So how are you at Lumeon? How did you get involved with technology?
Oh, it was quite serendipitous, actually. So I did my college exams. So I qualified in general medicine. Feels like an age ago, probably about 2008. Was applying off for what we call registrar jobs in the UK, and quite fortuitously came across a job in an IT company that's kind of specialized in clinical decision support and content. So I actually took some time off for a few months, was just, trying something out for a few months as a content editor, really making sure this company was creating content that was medically correct, etc. So started off in a content role, but actually found out I was actually much more interested in the technology and in how the content was delivered, the data behind the content. And so I actually moved much more into a product-based role over the months and the years. And the company I worked for kind of specialized in clinical decision support, and they had a number of different products or solutions, and I got to play with all of them. So I kind of got loads of experience in technology, how how solutions are developed, how we talk to customers, how we find out what they need and what they want, and how we translate those into ideas and concepts that we go on to develop. So yeah, it was something that was fortuitous, but kind of hit it at the right time, and actually learned loads from that initial exposure.
That's really cool. And just having that background, like studying to become like a doctor and whatnot, and like just your background in medicine has to be, when you're able to create content and all this and like work with technology, that has to be just a background that is so invaluable so valuable just because of that expertise and that know-how and like, oh, this is the usage case for it. And you can deliver that in a technology solution.
I think a lot of it's about talking different languages, right? So obviously being able to talk medical and understand how medicine is practiced and what some of the problems are from a technology perspective that clinicians face, you obviously are able to kind of vibe with them, right? You're able to understand their problems. And then as you pick up experience in technology and you kind of spend more time with like product teams or engineering teams, you kind of then be able to kind of help them understand what the real problem is and what are we trying to achieve. So I think, one of the things that I think is quite important is be able to cross that kind of clinical stroke technological barrier. And, a lot of what I do is kind of bridging the gap between different teams and making sure they truly understand what we're trying to do and what's the problem we're trying to fix for a customer, for a clinician.
You're talking about all the problems that Lumeon solves, and that leads us really into like our next segment of what we want to talk about. So can you give us like a little highlight of what have you been working on with customers to use the Lumeon platform to solve problems?
Yeah. As you know, the Lumeon platform is so, it can solve so many problems, right? It's a configuration engine, it's a configuration platform, etc. It's so versatile. But I think there are a number of things it's very good at. So areas where we have to reach out to both patients and physicians and being able to coordinate a patient's journey between the two, all with third-party providers as well. That kind of patient journey and the orchestration of it is something that Lumeon's very good at. So, the focus when I was working more on decision support was more alerts within the four walls of a consultation, and it's a pop-up in a workflow. And that was all very well. But actually, once the patient left the consultation, what happened after that? Yeah, did they do the things that they needed to? Were they prompted? Were they alerted? If once they'd done those things, was the clinician aware that that was finished and something else needed to be done? So that ability to kind of stitch up a personalized patient journey and trigger the right interactions between the two is unique, I think, from a Lumeon perspective. And, in terms of the platform and how it can be configured to do that. Some of the stuff we've been doing around peri-op. So, preparing patients for their surgery and making sure that they are reached out to, engaged, stratified, put into the right level of engagement in terms of what a clinician needs to do for them, and then given appropriate instructions. That, I'm simplifying ways a quite a complex process, but it's actually very valuable because it improves both the experience for the patient, but also for the clinician as well, right? Because the clinician feels like they are doing what is necessary for the patient, and it's not necessarily a one size fits all game that they're playing with.
A word that you use that I really like, two words that you use that I really was configuration engine, because there are so many different ways the platform can be configured to
Yeah.
specific ways. And as you also said, it benefits the patient and it also benefits the caregiver to help them, and also makes the patient journey just way more streamlined where they can like it. And I do want to talk about like configurations that we've done. What has been like the most interesting, like exciting thing that a client has used like the platform for that you really enjoy?
I think we've been doing a lot of work around interdisciplinary or multidisciplinary rounds recently. And so this is probably less patient focused, but it's more about the coordination of different teams who may be involved in the discharge of a patient. And, if you think about it, you could have, the providers, the physicians, the bedside nurse, but you could also have case managers, you could have social workers, you could have physiotherapists, etc. So that so many people could be involved in preparing a patient for their discharge. And we're not necessarily talking just about their medical readiness, it's their, are their discharge needs being met? And so we've been doing a lot of work around supporting that kind of interdisciplinary round, how we provide a tool that can provide the relevant information to support that round, but also enable tasks to be triggered, which are specific to that patient from the round, but then end up within the work queue in the EMR for a specific role. And so it's about small differences, right? So right now, tasks which are made on a round may be scribbled down on a piece of paper and they may not be actioned straight away and it might take a while. The ability to kind of push those tasks into a workflow or into a work queue that someone can see front and center, complete straight away, may only shave, a few minutes or half an hour off it being completed. But if you add it all up across all the tasks that need to be done, you end up having a significant impact on their length of stay. I think that's been a really interesting project because it's about making sure we've created a solution that's got a very good user experience so they can support around, but also from a technological integration perspective, being able to push all these things real time back into the queue has also been very interesting. And on it, we've also been extending that to think about our command center
Yeah.
as well. So we know that a lot of round discharge activities are actually administrative, kind of arranging transportation or arranging placement at a post-acute facility. And actually, some of the customers we've been working with have been looking at how they can centralize some of those functions across their hospitals, and the
Mm.
ability to kind of send those administrative tasks up to a centralized location so that they can be picked up by a team and handled at scale obviously brings efficiencies both financially, but also from an outcome perspective, getting things done quicker, more efficiently, getting the patient out once they're medically fit and reducing those delays, to length of stay.
I do want to talk about one point that you hit on there is like the UX that like Lumeon has built to make it super easy for people to adopt and then the technical implementation of that. Can you talk a little bit more about like how Lumeon makes it easy for people to adopt this platform within their hospitals and health systems?
Yeah, I mean, Lumeon's also an automation engine, isn't it? Well as a configuration and orchestration engine.
Mhm.
So a lot of what we do is in the background, and you don't necessarily have users interacting with it front and center. So I think what's been interesting with this project is actually building a tool where actually we're building a UI which is going to be used every day across multiple rounds by multiple people.
Mm.
And so our focus has been much more on the design, the feel, the look of the platform. I think we've reskinned it recently so that it has a much better look and feel, but also thinking about number of clicks and where they are clicking and how the information is presented. I think those all been things we've embraced over the last 6 months as we worked on the project.
I love that. I love that. And so we talk a lot about like, the configurations. Like we are a configuration, we can do so much. What's like a true like bread and butter that you like to talk about? Something that is like right in the Lumion wheelhouse of like clients use us to really like boost efficiency and help the patients.
That's a good question. I think we're starting to see the idea of managing managing appointments, regular kind of day-to-day appointments that patients would have. So we're talking about routine care. So patients who may need a physical, etc., their annual visit, or if they've got diabetes, they might have their annual diabetes visit, etc. The ability to reach out to those patients prior to their coming in to be able to collate information that's then used by the clinical team when that patient comes in actually is a really simple concept, but it saves the clinician so much time. It's time which is freed up in a consultation where they're having to ask a whole load of questions. They've already got cheat sheet which they can look at and use that as a prompt to the consultation. So, you know, it's not, particularly a sexy solution, but it does actually add value and is relatively simple to put in place. Similarly, we've been looking at automation of prep work for surgery. So right now, if you go and get cleared for surgery, you're given information about your surgery, where to go, what do you need to do a few days out, what do you need to stop eating, what do you need to stop drinking. And those are all instructions that are either given, verbally or on paper. But as you know, being in a consultation, you don't always take that information in, and actually being able to kind of deliver that information at the right time in an appropriate format and doing it in a way that's automated so that they get the right information at the right time, again, is a relatively simple solution for us to make. But I think it has a huge impact on a patient because they probably feel a bit more informed about what they need to do. They're prompted when they need to do it. And any late changes can also be accommodated. If their time of their surgery has changed and actually they need to arrive half an hour earlier or what have you, that can be, we can do the calculation in the back end and push that prompt out.
That's awesome. I do want to talk about like the benefits of like the patient as well. Can you talk a little bit more about like, a usage case for Lumion where like you guys we delivered results and it was like so beneficial for the patient where it's like something that really, you're very proud of it. There a usage case that comes to mind?
Yeah, well, I might talk about a project we're working on currently. So we haven't got results out yet. We haven't gone live, but it's looking at something which is quite close to my heart, actually. So screening and specifically kind
Mm.
of cancer screening. We're doing some projects around colorectal cancer screening, breast screening, etc. And right now, patients don't always complete the screenings that they should do. They, yeah, either they forget or they aren't prompted, etc. What we're doing now is we're doing a project where we're integrating directly with the EMR system to understand when a patient needs to have these screenings completed. And then so we determine when their due date is. And then we start, if they haven't booked an appointment, we start gently reminding them that they should get an appointment booked. Or if they have booked the appointment, we start preparing them for their appointment. What are the instructions that are needed? How do they prepare, etc. So there are huge numbers of people who need to undergo screening. It's not always possible for health systems, customers to call patients up and to prompt them. What we're trying to do is to automate that prompting process so that we drive more people through these screening pathways and hopefully kind of have a positive impact on early identification of patients with cancer that can be treated early, whilst not necessarily having to add a huge amount of burden onto customers in terms of what they need to do. So I think that's a really good example of where automated outreach and kind of algorithmic determination of what's needed is really powerful, and is something that Lumeon's really, it's something that kind of sits right in the heart of the Lumeon kind of sweet spot.
That's awesome. And just last question for you. What are like two things people should know about the Lumeon platform? You've hinted to a lot, but if two takeaways, if someone's listening to this, what are two things someone should know about the Lumeon platform?
Cool, good question. What should they know? Let's see. Well, I'd, I'd look at it slightly differently because it's so agile and versatile. I'd say for a customer, think about what processes you currently have, where you're maybe struggling to scale those processes, or where those processes may be quite resource intense. And think about whether you think any of the steps within those processes are amenable to automation. Because if they are, I think that's where Lumeon can help. If there's tasks like reaching out to patients, getting responses from patients, scoring patients according to existing kind of criteria and protocols, and then automating how those patients are brought into contact with your clinicians, those are bread and butter for Lumeon. So I think processes where you think we may be amenable to help through automation is probably a better way of looking at it. The Lumeon platform is so versatile; it can probably help do a vast amount of things. It's more if you think you've got processes that are amenable to automation, come and talk to us, and we can see what we can do.
Well, Dr. Gaj, thank you so much for joining us today. A ton of great content in here, really under the hood at the Lumeon platform. So thank you so much for joining us today. We really appreciate it.
No problem. Thanks, Ryan.